St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, anakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you for joining us to this discussion that is brought to you by Capuchin TV in conjunction with St. Mary's Mission Hospital in Langata. And we bring you this live discussion every Tuesday from 9 a.m. And I understand that we are a little bit late today, but don't worry because we have a lot signed up for you. Today we shall be talking about diabetic foot ulcer. Well, maybe you have ever heard of diabetic, but maybe not a diabetic foot ulcer. Don't worry because we have an expert in the studio. She will be telling us more about this topic. And welcome to this discussion. But before we start, we want to congratulate the KCSE candidates that we know they received their results yesterday. Congratulations to you all and wishing you all the very best. And a very good morning. Welcome. My name is Maureen Kimani. Hi, good morning, Dr.
Good morning. How are you? Very fine.
Thank you for making time coming here to Capuchin TV to enlighten our viewers.
Okay, thank you.
Yeah, maybe you can introduce yourself to our viewer. Okay. Say what's your name and what would you do in St. Mary's Mission Hospital?
Okay, my name is Cecilia Njeri Kamau. I work at St. Mary's Mission Hospital as a nurse, and mostly I work in the surgical department where we have this diabetic ulcer. Yes.
Okay, thank you for making time. You know, health is wealth.
Yes.
And that's why we bring this informative session to enlighten our viewer and to make sure they have the right information about their well-being, and especially when it comes to health.
Yeah.
Okay, we're talking about diabetic foot ulcer. What do you have to say? What is diabetic foot ulcer?
Okay, diabetic foot ulcer, ideally it is a break in the skin. Maybe you can show us an image. There's an image there. Ni kama tu kidonda. This only affects the diabetic patients who don't take preventive measures to prevent the occurrence of a diabetic foot ulcer. Yes.
So you talked about diabetic patients. How common is diabetic foot in Kenya?
It is very common because we have at least 15% of the patients with diabetic, they have diabetic ulcer. So it's very common, and actually it's the leading cause of amputation. Amputation means kukatwa mguu. So you find so many patients are ending up being amputated because they're not able to take care of just a simple ulcer. So it's very common in Kenya actually. Yes.
Okay, and talking about diabetic patients, do you have to say that it's mostly the patients who are diabetic are mostly at risk of having this diabetic foot ulcer?
Yes, they're the ones who are at risk of having an ulcer because of some of the things I'm going to talk about. I can't say it is common to other people, unlike the ones who have diabetes, because of some factors which contribute to them having a very high occurrence of having the ulcer. Yeah.
And what do you have to say that the diabetic patient should do, maybe to avoid having or maybe trying to regulate this diabetic foot ulcer?
Okay, number one, maybe I can start with some of the causes which make a diabetic patient have the ulcer. One of the causes is with increased levels of blood glucose. It causes the nerves to be damaged. So you find like most of the women siku hizi juu ya baridi wanawekelea tu mguu juu ya jiko. So you see when the leg is burning, they don't even realize because the nerves have already been damaged. So that is one thing that people are supposed to be very careful to prevent themselves from kuwekelea miguu juu ya jiko.
And it's a risk because, sorry for interrupting, you find some when they put their legs on kwa jiko, like they fell asleep.
Yes. So by the time they're coming to realize, oh, the leg is already burnt. And you see, with diabetic foot, they begin burning and they don't even realize it is burning because they've already lost the sensation. Also, you see patients with reduced blood flow to their feet. For example, those patients who have heart conditions, there is reduced blood flow to the feet. So you find these patients, when you get just a small ulcer, blood nourishes the feet. So when you have a small ulcer, it takes time to heal. So by the end of it all, it continues. By the time inafika hapa, there is no supply, so you end up being amputated. Yeah.
Before you continue with the courses, can you talk about what are some of the types of diabetic food?
Okay, we have 3 types of diabetic foot. Number 1, we have the neuropathic. This is the type of diabetic foot which is caused because of damage to the nerves. When the blood glucose levels are very high, they end up damaging the nerves. So when the nerves are damaged, then you cannot feel anything. You cannot feel when your legs are hot, they are cold. Ideally, you don't feel anything. Hata no wonder unasikianga mtu anakuambia ukitaka mtu akutolee kitu kwa jiko, tell somebody with diabetes, kwa sababu yeye asikii most of them. So atainua tu jiko. By the time she or he realizes, already burnt. So that is called the neuropathic. We have ischemic. Ischemic occurs due to reduced blood supply. So you find patients who have heart conditions, maybe they have reduced blood supply. And also when you have elevated blood glucose, it damages the blood vessels. So you find the blood vessels become thin, inakuwa kidogo. So even blood passing through the vessels, it becomes very difficult. So blood reaching the lower peripheries becomes very difficult. So this delays wound healing or makes the wound not even to heal at all. Then we have a third one, which is a combination of both ischemic and neuropathic. So you find somebody has lost sensation and also there is reduced blood supply to the feet. So that's the third cause. Yeah.
Wow, that's very interesting. Before we were talking about the types of diabetic foot, you talked about some of the causes of diabetic foot, one being the blood supply.
Yes.
What are some of the other causes of diabetic foot ulcer?
Okay, another cause of diabetic foot ulcer is increased pressure. You find, like, in nowadays people, they want to fit into fashion. So you really know you're a diabetic patient, but then you go and put in shoes that do not fit you. So by the end of it all, you find patient is having cones and colors. Maybe in the images, you can see a diagram. I'll show you a diagram of how these cones and colors come about. So by the time you're coming to realize it, the wound has already had the blisters. At the end of it all, it is an ulcer which is not healing. At the end of it all, it is amputation. So maybe this should go to everybody. When you put in shoes, put shoes that you know they are fitting well and there is enough room air to get inside your feet. Also, another cause is direct trauma. Like kama umeenda mahali umegongwa na meza and maybe you didn't even check your feet to know, after nimegongwa na meza, niliumia ama sikuumia. You know, at times, ukiwa kwa haraka zako, unagongwa tu ukienda. So that is another cause of the ulcer coming about. Yeah.
You were talking about the types of shoes. What do you have to tell the people with diabetes? Because you say they are the most people with higher risk of getting the diabetic foot ulcer. What are some of the type of the shoes you can maybe tell they should be wearing?
Okay, the type of shoes, number 1, they should be fitting. Don't put anything that is not fitting you properly. Number 2, avoid shoes kama hizi viatu za siku hizi Crocs. You know, somebody sweats a lot, and the more you sweating, it's ni kama chakula ya fungi, microorganisms. So they end up entering into in between the toes. Then that causes an ulcer. So they should be shoes which are inside. It is not. It's not this kind of Crocs. You understand that? Then it should have good aeration inside. Then also isikuwe ni kiatu iko hili. You see, like this one, yours is hilly. This one, mine. So
like this one? Do you have to see?
Yes. So you find that when somebody is walking, it exerts a lot of pressure in the heel. So this, at the end of it all, it starts forming blisters in the heels. So you just need a very comfortable shoe, which will not allow you to have this kind of ulcers. Yes.
And talking about that, because you are saying about the female ones putting on the shoes with the stiletto, maybe what we can advise them to do is maybe if you attend an event, you can have another pair of shoes to exchange. You can just feel very comfortable.
Yes.
Okay. And talking about the shoes, Do you have to say the people who are obesity or who are obese are at higher risk of having these diabetic foot ulcer?
Yes, because you see, they increase the pressure, especially on the lower foot. So at the end of it all, we say they are them and okay. The diabetic, most of the obese patients, they are at risk of having atherosclerosis. These are fats which are deposited in the blood vessels. So you see, when there is reduced blood supply to the lower extremities, it causes decreased wound healing. Yes.
And what are some of the signs of diabetic foot?
Okay, some of the signs and symptoms. Number one, you start feeling pain in your feet. Then, or warmth. Unasikia ukiguza mguu, leo ni baridi ama leo ni moto sana. It's not something that you're used to. Then also there's formation of blisters. Some of the patients don't even realize they have blisters. So akivaa socks, by the time anatoa, kuna iyo liquid iko kwa socks. Some of the patients don't even look at that. Maybe alishapata blister, ikatoboka na hakujua. And also tenderness. Ukiguza kuna hiyo uchungu. Then also pus formation. Unapata kidonda iko. At the end, unapata isha form pus. But you see, with some of these patients, wanaonanga kidonda imekuja. But wanasema, itaisha. Itaisha, 1 week, itaisha. And somebody cannot contact a podiatrist. A podiatrist are those specialists who take care of the feet, or even your physician. It's very important. Ukiona tuka kidonda kadogo, don't assume.
Take it for granted.
Yes, go to the hospital. At least with that, we know how to deal with it.
What about some of the people who prefer going to the chemist and buying some of the painkillers?
You see, buying painkillers, maybe you've just felt pain in the foot. You've bought a painkiller. Maybe that wound has been infected, and you are not even aware. The painkiller is going to reduce the pain, but the infection still remains. So please don't go to the chemist to buy drugs. Go to the hospital, see a physician who is going to give you the appropriate drugs. If it's for pain, you'll be given a painkiller, and also you'll be given an antibiotic which is best suited for your feet. Yes.
And let me take you back on the shoes. I feel it's a little bit sensitive.
Yes.
When we have these kind of friends who prefer, maybe sometimes they feel they want to borrow a shoe and go out. And do you have to say they're not supposed to do that because maybe you put number 40, the same as me?
Okay, number one, if you're borrowing shoes, you don't know if this person has a fungal infection. Because enye ukiniomba kiatu, I'll not tell you niko na fungal infection. I'll just tell you have it. So you see, people with diabetes, their immunity is usually compromised. So you're going to put on that feet. At the end of it all, you're going to have a fungal infection. Then you start developing an ulcer. At the end of it, who will suffer in the name of having nice shoes? It is you. So get your own shoes, even the ones that you buy from the mitumba. Make sure you wash them properly before you put them on. Yes.
Not maybe wiping them, you have to clean them.
Clean them properly, yes.
Okay, that's a very...
And also before you put on those shoes, make sure, especially for their diabetic patients, umeangalia ndani haina mawe. You know, once the nerves are damaged, wewe unavaa kiatu tu, you'll not realize kuna mawe ndani because the nerves are already damaged. So before you put it on, get inside, see if there's anything inside, ama ufanye hivi, kama kuna kitu ianguke chini. Don't just put them on without checking inside. Yes.
So maybe diabetic patients, they don't have to come to their pediatrist to confirm, is this shoe comfortable for me or is it not?
It's not a must for you to come, as long as the shoe is comfortable, there is good aeration, and it is well-fitting. You don't need to come. Yes.
Let's talk about how do you treat these diabetic foot ulcers?
Okay, when you come to the hospital, first of all, we want to take your blood sugars because that is the leading cause of having ulcers. So if they are not well monitored, we will start with that. We can maybe change your medications, or if you're not on medications and we realize you're diabetic, we start you on medication. Then for the ulcer, we usually dress with normal saline. Please, we advise people not to use Povidone. There is something called Povidone. It's a solution that people use, but they don't know it kills the cells. So the best thing is to use normal saline. So in our facility, we usually use that, and we are very specific wet to dry. That is, when you're dressing, you leave a gauze, which is very wet inside. That's what we mean, wet to dry. Then up you put a dry gauze, then you close the wound properly. But dressing must be done with normal saline. Unless the wound is infected, that's when we bring, maybe it has been infected by a certain bacteria. There's a bacteria which is called Pseudomonas. When that happens, you know vinegar?
The
one that is used in food.
Sure.
You can use that. You can mix it in normal saline.
Wow.
Yes. As long as maybe it has that kind of infection, it's called Pseudomonas. And that one you're going to know it very well because it is green in color. So when you're removing the dressing, you can see it is green. So you just use normal saline and vinegar to dress that wound. Within maybe a week, the patient is okay. Then we also do something called debridement. When you're dressing that wound, you see these ulcers with time, they start having dead tissues. And this is one of the reasons these wounds don't do well. So we remove off that dead tissue until when we see red. When the wound is red, then we know now we are doing well. So tutakata tu vizuri, at times to do it in theater, at least to make the patient not have a lot of pain because it's a bit painful. But some of these patients don't even feel it because it's already dead. Then the last thing is amputation. Kama imefika mahali there's nothing we can do, then we have to amputate. But before we amputate, we have to do some tests. There's something called CT angio. This helps us to know how the blood supply is going to the feet. But if there is reduced or no blood supply, we just amputate the leg. But before we reach amputation, we have tried. Yes.
Okay. I've ever heard of the cases maybe with the diabetic patients. I don't know if it's the diabetic foot ulcer. Sometimes their leg is cut.
Yes.
Is it because of the diabetic foot ulcer?
Yes.
So it can spread?
Yes, it spreads because with time, if the infection is too much, it begins from the skin, then it goes to the bone. When it goes to the bone, we call that osteomyelitis. And so at the end of it all, you may need to cut that part of the bone until the blood supply is well at that particular place. Otherwise, if you just say, wacha tuendelee kudress, you know the infection is still rising. And you see when the infection rises, it can get into the blood. So once it goes to the blood, then that's something else.
Wow.
Yes.
That's very interesting. I think we're going to take a very short break, and then when we come back later, we'll get to know what can we do to prevent these diabetic foot ulcers for those ones who are diabetic or maybe they're suffering from these diabetic foot ulcer. But thank you so much, Dr. Cecilia, for that first session. And in case you have any question from Cecilia, you can call us or you can text to us on 0717-424-866, or you can use our SMS number that is 21760. We're taking a very short break. We'll be right back. Stay tuned.
Capuchin TV, your Catholic broadcasting ministry. St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon, we have an oncologist, we also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic broadcasting ministry.
Welcome back, dear viewer, to this discussion of Health Talk with me, Maureen Kimani, and in the studio we have Cecilia Njeri Kamau from St. Mary's Mission Hospital, and she is trying to help us to understand about this topic that we are discussing today, that is diabetic foot ulcer. Thank you for the first part, and thank you for joining us on this second part. Welcome, Cecilia.
Thank you.
Yeah, before we talk about the preventive measures of this diabetic foot, can you tell us some of the stages of diabetic foot ulcers?
Okay, the stages, it begins with something called a defeat ulcer. That is when you start feeling kuna kitu inafura. The ideal ulcer has not started forming. It's like when you touch your feet, you can feel there's some warmth. So already the ulcer has not started forming. Then we go to the next stage. Now we have a superficial ulcer. Now you can see the ulcer. The ulcer is the kidonda. It has already started forming, but it's just superficial. Haiko juu tu. Then we have, that stage is now the deep ulcer. Sasa imeanza kuchimba ndani. Then the fourth stage is called osteitis. This is whereby it has started invading the bone. Then the other stage is superficial gangrene. This is whereby gangrene is the death of a tissue. So it has started eating the bone slowly by slowly. So the third stage is whereby the whole feet becomes gangrenous. If you want to know that your feet is gangrenous, it starts becoming black in color. I don't know if you've seen a black feet.
I'm sure.
Yes. So with time, your feet starts changing color and it becomes black. I mean black. So that's the end stage of diabetic ulcer. So when it reaches there, most of the patients, we just amputate the leg, because when there is the presence of that black color, it shows that there is reduced blood supply to that particular part of the feet. So we just amputate the leg. Yes.
Because we don't want the patients to be amputated,
yes.
What are some of the preventive measures that one can do to prevent this diabetic foot ulcer?
So we have the do's and the don'ts. Some of the do's is make sure you examine your feet every day. Anytime, mukitoa tu viatu, the first thing after taking a shower, you examine your feet. So what are you examining for? Once you remove your shoes, you feel for your feet if it is warm, because some of these infections, they start with the feet being warm. Kajoto, ni kama vile ukipata pass somewhere, how you feel it a bit warm. That's how it starts, or very cold.
What about, sorry for interrupting,
It's okay.
What about those people who feel very nervous sometimes, and they start sweating even their legs, and maybe they are in a meeting and they have to take longer, maybe even the whole day?
Okay, as we had said earlier, sweating is one of the ni kama chakula ya fungi. They love somewhere where it's sweaty. So that's why we are advising, put on shoes that you know they're not going to make you sweat, and you must put on socks. Please avoid putting Crocs. You find so many women going to the shamba, wamevaa Crocs, bila socks.
People love them.
Yes. By the time unafika kwa shamba, your nerves are already damaged. So hata miba ikiingia, you're not going to realize it. And that's why I'm saying it is good. The first thing, you need to examine your feet every day. So you first feel if it is warm or cold. That's the first thing. Number two, you check in between your toes. Some of us, you just take a shower. After umeoga, unapanguza mwili, mguu unapanguza tu juu, hupanguzi katikati ya miguu. It is very important, have something clean. You can have a separate towel, ama tu shuka cotton, unapanguza katikati ya miguu. Some of us, hata kujipanguza, the kind of towel you're using is not a towel which is going to wipe in between your toes. So you need something like cotton, either lesso, a towel, you can choose. Also, after checking in between your toes, you check if you have any blisters. We have an image of some of the colors and cones. There are some things which grow huku kwa miguu, kwa the toes. Ukifinya hivi nasikia ni ngumu. So you see, most patients, they want to remove these cones with a blade, which is never allowed. If you have those cones, come to the hospital, because we have the ideal treatment for that. Because you're going to cut it and you're not going to realize, oh, I cut the skin. The next minute is an ulcer. So don't cut those cones and calluses. Then avoid going to, you see this, when you go for pedicure and manicure, you want to be soaked in water. It is actually have regulated temperatures of water. So inaenda hivyo inakuwa moto. I think that's what happens when you in that thing to make your legs. So when you're soaking your legs, so avoid those kind of things, because you're not going to know when that water is becoming hot. Your nerves are already damaged. So avoid soaking your feet. Avoid that completely.
What about those ones for the ladies who, even for the men, they now like go to do their pedicure maybe twice in a month because they want to keep their nails, their feet, you know, clean?
Yes.
What about them? Do you see they are exposed, especially for the diabetic patients?
Yes, they are very much exposed because you see, you're staying in water for a long time. Then this water, it is heated. You don't have the exact temperatures because these are temperatures which go rising, fall down. That's what happens. So if you're a diabetic patient, you're not going to realize, oh, the water is now getting hot. You just continue enjoying yourself. The next minute, your feet are already burnt. So if you can avoid that, the better. Yes.
Beauty comes with expenses.
It comes
so
with
you have to be careful.
Yes, yes, yes. Then something else, when you're cutting your nails, please don't cut the edges. Just cut the top of the nail, but the edges you file. Because some of the patients, by the time you're going to cut the edges, you end up cutting a part of the skin and you're not going to realize it. So with time, it starts forming an ulcer. So please have something, maybe a nail cutter, avoid blades. You can have a nail cutter, then a file to file the edges. Then something else, avoid walking barefoot. You see, with time, with this modernization, you find mtu akifika kwa nyumba, because there is a carpet, you just walk on top of the carpet. Maybe something was broke, you didn't recognize it. You just step, maybe you kanyage chupa and you're not even aware. So make sure you have shoes all the time, inside and outside. Then the other thing is make sure you put shoes which are fitting. I'm still insisting on the shoes. Shoes which are fitting. Shoes which are not exerting pressures on your toes or below your foot. Yeah. So then the last one is enjoy your toes. Shinda ukifanya hivi so that you increase the blood supply to your toes. Saa zingine when you're in meetings, you just stay like this. Your toes relax, so that is one way of increasing the blood supply. Just wiggle your toes. Yes.
You talked about wiggling our toes. That means you have to exercise them.
Yes, yes, yes.
Do you have to say that people with diabetic foot ulcers cannot do exercises?
Yes, they're supposed to do exercises, but don't put or exert extreme pressures. You know, kuna zile exercise, unasema I want to run, sijui how many meters in how many minutes. You can walk, not necessary for you to run, because you see some of these people are aged people. You can just walk and say, today I want to walk this kind of meters. Just walk pole pole. As long as your shoes are fitting, you're good. Please don't walk with Crocs. I still insist on that. Yeah.
Okay, talking about the old age, what is the minimum age of these, whichever case you have maybe come along for the people with a diabetic foot ulcer?
Diabetic foot ulcer can affect even the young. It's not necessarily the old people. Because you see, especially the type 1 diabetes, these are insulin-dependent patients. So that means they are monitoring their sugars for a very long time. Some of them don't monitor it very well. So what happens? This blood glucose, it starts destroying the nerves. It starts causing a change in the blood vessels. So if you're not monitoring your sugars well, however young you are, 21, 30, you can get the diabetic foot ulcer. Old age, at times it comes, most of these people, actually they know how to manage their sugars better than the young people. But now you see the problem, the immunity is compromised. With time, there is decreased immunity. So, yeye akigongwa na kitu kidogo, infection setting in is very easy. And then you see sugars, they usually impair the white blood cells. The white blood cells are ni askari wa mwili. So you see when your sugars are elevated, your white blood cells are impaired, so they're not able to fight infections. So when you have a small ulcer, with time it becomes infected. Yes.
Okay. Wow, that's quite interesting. What are some other condition of this diabetic foot ulcer?
Okay, we have you see patients with athlete's foot. So ukioga unabakisha maji huko, with time you get athlete's foot. So with this kind of condition, it is very easy for you to get a diabetic ulcer. I think that is the most condition which can bring the ulcer. And also we have these patients who have deformities or ingrowth toes, unaona kidole ina grow, inaanza kuingia ndani. I don't know if you've seen that. It's called ingrowth. Like you have long nails, then they start bending, they start getting inside your skin. So this one is going to cause an ulcer. And if you're not used to checking your feet regularly, you're not able to realize, oh, my toe is getting into my skin. So you don't take the correct measures. Yeah.
That comes with the hygiene because we are talking about the towels, wiping your toes, your feet very well, cutting your nails. So you have to take care of your body, every part of it. It's very essential because, you know, sometimes people assume, sini mguu.
Yes.
Kwani nitafanya? So what do you have to say about that?
I think people need to be very careful when it comes to hygiene. Once you take a good shower, make sure you apply lotion into your legs. Please don't put lotion in between your toes because that creates a room for fungi infection coming up. Oga vizuri, paka your feet lotion. You can avoid the solid because the solid oil in the toes, they usually cause moisture to increase. So lotion you just apply up, katikati ya mguu you just dry it up. The reason we want you to put lotion, it smoothens the feet. Otherwise, ukioga tu na upaki mafuta, you see these cracks that start coming up. Those are very good sources of infection. So lazima unaweka tu mafuta vizuri as long as not in between the toes to avoid those cracks which come along.
This goes mostly to the men because they don't totally don't apply, you know, mafuta.
Yes.
What about those ones who use soap as they don't apply the lotion, they don't use the solid, but they use maybe the soap alafu wanapaka maji, they just spread it to their legs?
Don't do that because you see when you just put soap, it also starts bringing about those cracks. You see, the main essence of the lotion is just to smoothen. So if you put soap, with time it starts hardening. So what happens? At the end of it all, it starts forming those cracks. Then also, this goes especially to the women. Women love stockings. When you're sleeping, you find somebody has a long stocking up to here or just the short stockings. This one impairs the blood supply to the feet. So avoid those stockings. And if you're going to put on socks, don't put very heavy socks because you're going to sweat. Just put comfortable socks. Yes. But for the stockings, please avoid that because it is, you know, I remember sometimes at school, we used to put socks, then hapo juu naweka karaba band ndio isianguke. You see, when you're doing that, this is impairing the circulation to the feet. So just put something comfortable which is not tight in hapa juu. Yes.
Talking about the socks, you know, the weather has just changed from yesterday. It's been raining, so it's very cold. And sometimes you find people sleeping with socks. Does that mean you're exposed to this diabetic foot ulcer?
Not really. As long as you put socks which are comfortable, which are not tightening, and socks which allow good air entry. Those ones are okay.
So sleeping with socks is
okay.
not bad.
But if you can, just avoid the socks.
Okay.
If you can, after you put lotion vizuri, jifunike vizuri. But if you must, put on socks, but put socks which are comfortable. Don't put the ones which tight here and they're not able to allow good entry of air.
Okay, thank you so much. And can this diabetic foot ulcer be cured?
Yes, it can be cured if it is recognized early. You see, we have stages up to us reaching the gangrenous point. If you realize that you already have the ulcer, come to hospital immediately. Normally what we do, if it has already started having pus, we collect that pus, we take it to the lab so that we are able to identify what kind of microorganism is invading this foot. So once you have the results, we are able to give you the right kind of antibiotics. Then with continuous dressing, then you have your feet back. But now you see, most of the patients, they only come to hospital when the wound it has already progressed. But also when you're doing the amputation, you just don't amputate the whole leg. We have a way that we start amputation. You can start with the toe if it is the toe which is infected and there is reduced blood supply to that toe. So you can start with the toe, you can go pole pole. But now you see some of these patients, the infection has already risen up to the hip joint. So what happens? You have to amputate up to there. So before it reaches there, Once you realize you have a blister, and that's why we advise him, keep on checking your feet every day. It is not going to take you even more than 5 minutes, and this could save you an amputation. Yes.
Okay, thank you for that. And after curing this diabetic foot ulcer, can they reoccur again?
Yes, they can reoccur again if you don't control your blood glucose levels. There is a test that we always recommend for patients, especially patients who have not been using their treatment, their blood glucose treatment well, or the anti-diabetic drugs. There's something we call HbA1c. It's a test that we do. This test is going to help us know for the last month, the last 3 months, have your sugars been well controlled? So we do that, and we do a daily monitoring of the sugars. So if the sugars are not well controlled, of course they are going to damage the nerves. Of course they are going to damage the blood vessels. So it is something that can reoccur. So if we treat you today, then you go home and you don't monitor your blood sugars, or maybe you expose yourself, maybe wewe unaekelea miguu juu ya jiko, you'll still come back. So I think we just need to be very cautious. As long as your sugars are well monitored and you're careful, then I think they're not going to reoccur again. Yes.
Okay, before we wind up, maybe you can talk about some of the complications of this diabetic foot ulcer.
Okay, the main complication is gangrenous foot. Gangrene is whereby the infection has already invaded, there's reduced blood supply to the foot. So when it reaches that point, the only end result is amputation. That is the main complication. Amputation is no, you start cutting, today you cut this part, tomorrow this other part, the other part like that. At the end of it all, you find you have no feet, just because of a small ulcer. And this is something that you can prevent with all the preventive measures that I've talked about. I think you can prevent the amputation part of it, yes.
Prevention is better than cure.
Yes, yes.
Okay, thank you so much, Madam Cecilia Kamau, for that session. We have really enjoyed, and hoping to our viewers they have the same case. And before we wind up, maybe if you have something to talk about this diabetic foot ulcer in general.
Okay, we have very good surgeons in our facilities who take care of our feet, and these are found in St. Mary's Mission Hospital. We have Dr. Frida, we have Dr. Kazoya, and we have other specialists. So, and we also have consultants. We have Dr. Gituma. So for your blood glucose, at least you know that is catered for. When you come on Tuesdays, you're going to find Dr. Gituma. When you come on Mondays, you're going to find Dr. Frida. When you come on Wednesdays, you're going to find Dr. Kazoya. So just know that your feet are cared for in St. Mary's Mission Hospital.
Wow,
yes,
that's very nice. You talked about Monday, Tuesday, and Wednesday.
Yes.
From what time?
At least be there from 8 a.m. because the patients are so many. So come as early as possible so that we can do the correct workup for you, so that you'll have a happy feet when you're going home. Yes.
Awesome. What's your parting shot to our viewer in this topic of diabetic foot ulcer? What can you tell them?
What I can tell them is prevention is better than cure. We don't want to amputate that leg. Please take good care of your feet, hygiene, regular checkups, take care of your blood glucose. Don't stay for 1 month, 2 months without going to the hospital or checking your blood sugars, because in the name of I am using medication and you don't even check how they are. So please let us monitor our blood sugar so that we are not going to end up being amputated or having other major complications. So prevention. Yes.
Before we wind up, let me ask you a question. How long is the person supposed to stay with their shoes? Are you supposed to change because we have some, they have 4 years?
Yes.
5 years?
We usually say if you can, maybe 1 year. Because I'll not tell you, but you see, siku hizi with budget, even if you tell somebody 1 year, it's still something. But maybe you can have 2 or 3 pairs of shoe, because we advise the shoe that you put today, don't put it tomorrow. At least get another pair, anika hii, panguza uanike nje. Tomorrow put on another pair. Then hiyo siku ingine rudisha ile ulivaa Monday. So you can have 2 pairs, then maybe a Sunday.
Wow. Yeah. All has been said. I don't have much to say, but thank you so much for making time.
Yeah,
thank you to St. Mary's Mission Hospital for having brought you here to come and share to our viewer and to enlighten them. information is power, as we said. Thank you so much, and may God bless you. Thank you to the team that has been behind the scene, the Capuchin TV crew member. We have Felix Juma, Michael Ndegwa, DJ Fredox. Lastly, we have Michael Gatimo, who is our transmission manager. Thank you so much for these for helping us to transmit this live discussion to our viewer and making sure they have the information. And in case you are joining us right now, don't worry, because you can follow this session later on our YouTube. Stay tuned, because every Tuesday we bring you this informative session. May God bless you. My name is Maureen Kimani. Have a blessed day.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya naachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.